A talk delivered by Dr. Herbert M. Shelton at New York City in July 1957.
Antonio, Texas. Thank you, Jack. Mr. Chairman, ladies and gentlemen, I've been losing so much sleep at this hygienic convention that my memory has been slipping cogs. And this morning I delivered the talk that I should deliver this evening, so this evening I'm going to have to talk on the subject that I should have talked on this morning. Before I begin, however, let me make a little announcement of my own. From 12 o'clock tonight to 2 o'clock in the morning, Dr. John Curcio and I will be on radio station WHOM, 1480 on your dial. Now, if you don't hear enough of us here this evening, and you want to sit up and listen a while longer, why, you may tune in on that program during those 2 hours. Those of you who sat up all night the other night and listened to the one on the Long John program may not want to sit up again tonight. WHOM, 1480 on your dial. 1480 on your dial. You see, you have radio stations here in your city that you don't even know about. From 12 to 2. If you're a good hygienist, you'll be asleep. If you're not asleep, by the time we get through with you, you will be. A lot of them the other night who listened in on us said, I listened to a certain time and then I fell asleep. I don't know whether it was Chris or I who talked him to sleep, but we worked it anyhow, somehow. Now to come down to the subject of the evening, sick children. Let me begin by saying that diseases of children are parents' mistakes. Children, babies and young children, do not make themselves sick. Of course, I know all of you will say, well, we know that. But we don't make them sick. I take good care of my children. I don't know why they get sick. I guess it was a virus, or a germ, or a change in the weather, or a little exposure, or little Johnny got his feet wet, or some such simple thing as that which made the baby sick. The fact is that babies are ushered into this world with a lot of meddlesome midwifery. The stuffing program is begun almost from the instant of birth. Nowadays, they're born in hospitals. And they begin immediately to feed them water with sugar in it. And then they start feeding them out of a bottle. As I have explained before, it is assumed from the beginning that the modern mother, is not going to nurse her baby. The cow has been adopted. They're stuffed, they're overhandled, they're overbathed, they're overexcited, and then when they have a little trouble, they're drugged. They have a little sniffles, they have a slight rash, they have the colic, they have a diarrhea, they're slightly constipated. Some slight trouble develops, and immediately they're drugged. Milk of magnesia, perhaps, given for the constipation. Some of the favorite cold remedies of the present. I don't know whether I ever told this particular audience, or that most of you here or not, how many cold cures there have been discovered since the first primitive magician began to treat colds. But I made a careful count of them at one time, and I found there were 9,652. Now, any of you who may be inclined to doubt that count are perfectly privileged to go back and make the count yourself. But the cold cures have come, and the cold cures have passed in such great numbers that my count may actually be accurate. I may have too few cold cures in my summation. But you use them in drugging your little baby. It may only be a few days old. Let me point out to you at the very beginning that the first cold of infancy, the first sniffle, the first hives, the first diarrhea, the first feverishness, the first constipation, the first sign of trouble in that baby indicates an established toxemia. Now, what do I mean by toxemia? If you look it up in your medical dictionary, you'll be likely to come up with the thought that it's a toxic state of the blood caused by germs. That is not what I'm talking about. We are born into a world in which germs are almost as numerous as the atoms of which the earth is composed. We are born into a world that is teeming with microbes of all kinds. They're in the water we drink, in the air we breathe, in the food we eat. They're in our clothes, they're on our hands, they're in our nose and throat. They're everywhere. You simply have to learn to live with them. Unfortunately, that's a very easy thing to do because they're rather harmless little fellows. Toxemia, as we use the term, is a state of self-poisoning. It is the consequence of the retention within the body, that is, in the blood, in the lymph, and in the tissues, of the normal waste products, of the normal activities of life. The very act of living, all the acts of living, and all other activities of mind and body give rise to toxins. The production of poisonous toxins, poisonous substances, waste matter, metabolites, end products of metabolism, call them by whatever term we choose, these products are in continuous production from before birth until death. Day and night, asleep or awake, they're being produced. Normally, they're as continuously being removed from the tissues, taken by the bloodstream to the organs of elimination, and excreted. So long as that process of removal and excretion of toxins or waste matter is normal, they keep the blood and lymph and tissues sweet and clean, and no disease develops. But once excretion lags, there commences the accumulation of waste matter in the blood, lymph, and tissue, producing the condition that we call toxemia. Elimination lags consequent upon a lowering of functioning power, or to be more specific, a lowering of nerve energy. And nerve energy is lowered by all excitement and all excesses and all stimulations and all emotionalism and all habits of all kinds that use up nerve energy in excess. In the case of the baby, overfeeding, overexcitement, overbathing, overclothing, overheating. Chiefly these things are responsible for the toxemic condition of a baby. But innervation or lowered nerve energy does not merely check excretion or elimination. It also checks secretion. And when secretion is checked, particularly when the secretions of the digestive system are checked, there results decomposition of food in the digestive tract. The baby has colic. It has diarrhea. It has pains and discomforts and distresses of various kinds, and it cries. It may have fever. A child may have a fever, but from very slight causes, a cause that an adult would pass off without any disturbance at all to its organism. The decomposition of food in the intestines, and particularly if that baby is being fed upon a high-protein diet, gives rise to violent toxins that, when introduced into the bloodstream, give us such eruptive diseases as measles and scarlet fever and smallpox, chicken pox, and so forth. Even pneumonia results from the absorption into the bloodstream of the toxic decomposition products of protein origin. The combination of these two sources of toxins, the retention of normal waste and the absorption of decomposition products from the intestine, give us symptoms galore. And diseases are simply symptom complexes. The other night we were discussing something of this kind on the radio, and Dr. Curcio brought up the medical theory that diseases undergo changes. They undergo evolutionary changes. And sometimes they disappear altogether. I personally think that this particular medical theory is a lot of plain nonsense. Diseases do not lose their virulency. They do not undergo changes. They do not undergo evolutions for the simple reason that there is no such thing as disease. We had a medical man on that program with us, and he discussed disease. And he talked about you had to come in contact with the disease in order to get it. He was talking about infectious ones. And I asked him where. We took the first case of smallpox. Of course, we don't know who had that first case. I asked him where the first case of smallpox got his smallpox. And I followed by the assertion that if one man can develop smallpox without coming in contact with a prior case of smallpox, then 1,000,000 men can develop smallpox without coming in contact with a prior case. We don't need to transmit disease from one person to another. We don't need attacking entities that float around in the air and pounce upon us out of their hiding places in the dark when we least expect them. Our diseases are self-evolved, and they're nothing more than symptom complexes. And there never was a disease, any two cases of which were alike. I mean a so-called disease. There never was two cases of pneumonia that were alike. There never were two cases of typhoid fever that were alike. There never were two cases of measles. The differences in these symptom complexes stem from the differences in the individuals that evolve the symptom complexes. The differences in their constitution, the differences in their toxic condition, the differences in their environment, the differences in the stresses to which they have been subjected. These are the things that determine the differences in two cases of the same symptom complex, whether in an infant or in an adult. And when the environment and the living habits of a people change, as they have been changing in this country and changing greatly for more than 100 years. So-called diseases undergo changes, not because there was a disease to change, but because the people have changed, because their habits have changed, because their mode of living has changed. When a body becomes toxemic, whether a baby or an adult, when a body becomes toxemic, when it becomes saturated with the accumulated waste matter that has not been excreted, when toxins are absorbed from the intestine, they must be eliminated. The process of vicarious or compensatory elimination by which those toxins are cast out is the process that we call disease. Disease, in other words, is a remedial process. If to some of you that sounds like a rash statement, let me take a brief time to analyze 2 or 3 symptoms. Let us take coughing. We have a man walking along the street. He takes a deep breath and he takes into his lungs a particle of dust or a passing gnat, and it immediately irritation sets up. Now, I didn't say the gnat caused the irritation. It occasioned the irritation. Coughing develops. There is violent coughing. The gnat is expelled. The coughing ceases. The coughing is a symptom of disease. It is an expulsive process. It expels the substance that was obstructing the respiratory passages. Had that not lodged in the nostrils, sneezing would have occurred instead of coughing. It would have expelled the gnat. In either case, the sneezing or the coughing served the same function, the same purpose, that of expulsion of offending material. You take a poison into your stomach, and vomiting follows. Now, vomiting is one of the symptoms of disease. There's nausea and there's vomiting. And there may be very violent vomiting. And you may feel very sick and very weak. But the vomiting is the process by which that poison is expelled. Or the poison may be expelled by diarrhea, which is only a bowel movement, but a vigorous one, a violent one. Now let us look at that diarrhea. Besides the bowel movement, there is the outpouring by the glands, by the mucous glands in the lining membrane of the stomach and intestine and colon of a large quantity of watery mucus. First to dilute, and second to flush away the offending material. There is violent muscular action. It's sometimes so violent that you feel like you're being torn apart. Griping, you call it. All of this are symptoms of disease. But again, it is nothing more nor less than an expulsion of a poison. And thus we might go on and on and on with symptom after symptom after symptom and end up with nothing but life-saving, life-defending processes. This is one of the reasons that we not only say that disease cannot be cured, but we add that it should not be cured. When you cure the remedial process, your patient is dead. When you suppress it, you endanger his life. Fortunately, it is impossible to completely suppress it in most instances, so that most patients succeed in getting well, or nearly well. Very few patients ever get well. They get nearly well in spite of, not because of, the treatment that is administered to them. Now, in saying that, I am not talking exclusively of drug treatment. This is, of course, the most vicious form of treatment, the most destructive and obstructive form of treatment to which the sick are subjected. But I include in that the other forms of treatment, the boiling and frying and roasting and toasting and electrocuting, forms of treatment that the physiotherapists use, the mauling and pulling and pounding and twisting and punching and cracking treatments of the osteopaths and the chiropractors, the herbal methods and the hydrotherapy and all of this kind of stuff of the naturopath, the hypnotism and the suggestion and the prayers and the other forms of religious and psychological treatments of the psychotherapists, psychoanalysts, psychiatrists, and Christian scientists, the knives and saws and chisels and hammers of the surgeon. I include all of these things. I include all of these things when I say that most of the people who die and have it written on their birth certificates that they die of disease are killed by the treatment that is intended to cure them. And it does. For as I said before, when your patient is cured, he is dead. Babies and children should not be sick. If they are properly cared for from before birth to the time when they take over their own lives to run them themselves, they will remain well through that time. You will bring up healthy, vigorous, well-developed children. They will not have polio. I wonder if any of you ever heard of the child of a hygienist having polio. If you have, let me see your hand. I have not heard of, nor found anybody else who has heard of a child of a hygienist anywhere in the United States having polio. And this was true before the days of the Salk vaccine, and it's still true because none of them have had their children vaccinated with that monkey juice. It's even true in spite of the fact that there are many people who call themselves hygienists who have not more than a half conception of what it is and do not live up to it very carefully or fully. The death of children in acute diseases remind me very much of the story of the Irishman who working in the garden, accidentally swallowed a potato bug. He knew that they used Paris green to kill potato bugs, so he ran into the house and took a heavy dose of Paris green. A few days later, in telling his friend about it, he says, "And begory, Pat, that darn little bug almost killed me." We have some acute illness in our children, and we call in a physician and he starts the poisoning process. He reduces the fever, he suppresses the cough, he relieves the pain, he stops the diarrhea, and he insists on feeding the patient. You remember a few years ago there was a lot of stories in the newspapers about diarrhea among infants and children around over the country, and especially in the hospitals. Wonderful places, these hospitals. They were actually holding babies' noses to force them to open their mouths, and then while they had the mouth open, putting food in it, forcing these babies to eat in spite of the fact that old Mother Nature had cut off all demand for food. And the death rate in the condition was very high. Oh, they were looking for the virus. They had it in their hands all the time, didn't recognize it. Every one of those children that died, not from diarrhea, but while they had diarrhea, died because of the stuffing and the drugging that they received. Not one of them would have died had it been cared for hygienically from the outset of his trouble. As a matter of fact, even our top-ranking medical men say the same thing while ignoring what they say in practice. They actually say that if these children are starved, which is the wrong term, they'll get well. A child with diarrhea should not have any food of any kind. Water alone should be taken into its mouth or into its digestive tract until the diarrhea ceases. No drugs, no food. The child should be put to bed. It should be kept warm. Noise and visitors should be kept out of the room. It should be permitted to sleep as it will. Amazing how they sleep when you stop feeding them. It's amazing how long and weary nights parents walk the floor with them when they feed them, because the children are crying all the time. They're uncomfortable, they're painful. And they cry, and they cry, and the parents walk the floor, and they walk the floor. And they don't get any sleep, and the baby doesn't get any sleep. When all they have to do is stop drugging and feeding, and the baby sleeps about 20 hours out of 24. You hardly know you've got a baby around the house, much less a sick one. I've been in practice for 29 years, 39 years. In that time, I have never had a single death of a patient, old or young, in acute disease. These diseases ranged all the way from a common cold to diphtheria, typhoid fever, smallpox, and polio. Never one death in any acute disease in child or adult. That has helped to reduce the death rate in these diseases, and it has enabled the medical profession to claim a great reduction in the death rate due to the improvement of their drugging practices. The care of an acute case is so simple that a 10-year-old child can be taught to do it as more successfully than it is being done. It is so simple. Now, we don't try to cure disease. We don't have to. We know that the disease is a remedial process. We know that we need only to place the sick organism under the most favorable conditions for the successful operations of the remedial processes that are in progress, to have them carry forward their work to a successful completion in nearly all cases. I said nearly all because I think there may be babies that are born that are so weak from birth, congenitally so weak, that they simply can't live anyhow. So occasionally one of these may die, although I haven't had one to do so. I've had them that I had warned the parents before they even had children not to have any. And the children, when they were born, were so weak and so puny that sometimes I didn't think they were going to live, but they managed to pull through. I care for measles and scarlet fever and chicken pox and whooping cough and all these so-called infectious diseases of childhood. In the same way, we don't have to have a specific for one and another specific for the other and another specific for the other and so forth. You don't have to have a specific for typhoid or for pneumonia. You don't even have to have a different kind of treatment. As a matter of fact, you don't have to have any kind of treatment at all. The less treatment you have, the better off the patient. What is needed is simply rest and warmth and fresh air and quiet and no food. And a little bit of courage and faith and hope on the part of the parents. Parents subject their children to all kinds of damaging treatments because they are frightened. It's amazing how much fear, particularly a woman who is the first mother, can develop when her child develops the slightest trouble. She just knows the child is going to die. She gets frightened. She calls in a physician. She calls in a chiropractor. She calls in a naturopath. She calls in an osteopath. She calls in a Christian Science practitioner. She calls in the pastor of the church. And they pray. Well, if I had to take my choice between pills or prayers, I'd choose the prayers. But I would choose the prayers knowing that they weren't going to do me any good, but at the same time they weren't going to do me any harm as the pills would. Getting well is a vital process. It's a biological process. It is a process that is in continuous operation in the lives of every one of you. It is in continuous operation because every one of you is sick. Every one of you has something wrong with you. And you're slowly growing worse through the years because you aren't living as you should, because you're not correcting your mode of living. You're toxemic and you're content to go on day after day and remain that way. You're enervated, and you keep enervating yourself. As a matter of fact, you come out here and spend all night instead of going to sleep. You do these things to yourselves, to your children, and then you expect to continue doing them and remove the effects of them by taking some pills or powders or having your tonsils removed, your appendix cut out, or some other part of your body whittled away by a very skillful surgeon. Some of them are very skillful. I've seen more people with surgical fleur-de-lises on their abdomens than I can count. Beautiful work. You should see the beautiful stitching they can do. Yes, they're very skillful. There is no doubt that surgical skill has increased greatly during the past half-century. And there is also no doubt that the increased employment of this surgical skill in performing operations that are crimes has increased in proportion. We discussed cancer on the program the other night. There is a great increase in the incidence of cancer. And there is a great increase in the death rate from cancer. You know, the death rate increases in spite of the fact that they are curing more cases than they ever cured before. They're just curing them and curing them and curing them. In other words, they're curing them like the old Irish doctor said when he sent the bill to the patient's husband for curing your wife until she died. They just keep curing these cases. And I am convinced from my own experiences and observations of the cases that have come to me that the majority of the cases of cancer that are diagnosed as such today are diagnoses and not cancer. Cancer is in the air. It's amazing how many people come to me and say, I've got a pain in my leg. Do you think I've got cancer? I have a pain here in my chest. Could it be cancer? I've been losing weight for the last week or two. Could it be cancer? Cancer is on their brains. They've been brainwashed with cancer. But not merely the people have been brainwashed, the profession has been brainwashed. Everybody has been brainwashed. The American Cancer Society doesn't let anybody forget that they're in existence and they need your coin. So cancer is in the air, and cancer is diagnosed at least 50 times out of every 100 when there isn't any cancer. Probably a higher percentage than that. One friend of mine said, from my observations and experiences, I think that 85% of these cases that they diagnose as cancer are not. They take the breasts off of thousands upon thousands of women in this country every year because there's a little lump in the breast. 95% of those lumps would never be anything more than a little lump if they were left alone until the woman died at the age of 106. Practically every one of them could be eradicated by hygienic methods in from 3 days to 6 weeks, and with proper living afterwards, no recurrence of them. Please bear in mind that the chronic diseases that we have, that we develop, when we get up in what we call later life, and it is later life for most of us, although it shouldn't be late, are merely the endpoints in a progressive pathological evolution that had its beginning in infancy. Its first manifestation in that simple sniffles that developed perhaps a few days after birth. An established toxemia is indicated by that first cold. And due to our mode of living and our mode of treatment of our troubles, we remain toxemic throughout our lives, growing progressively more toxemic as we go along, learning to tolerate the toxins much in the same way that we learn to tolerate tobacco when we begin with small doses of tobacco and gradually increase the amount we take. But slowly developing chronic disease as a result of the chronic poisoning, the mounting poisoning, as the years go by. The time to begin to prevent cancer is not after a growth has developed and to cut it out early, but in infancy. Maintain a state of first-class health throughout life, based upon first-class habits throughout life, and stop worrying about cancer or polio in your children or cancer in yourself or any other disease. I don't worry about the infectious diseases. If I'm called to see a case of smallpox, and I have been called, do you think I worry about it? I haven't been vaccinated. I'd be more afraid of it if I had been. I've never been inoculated or immunized, I believe they say, against diphtheria, but I've never worried about cases when I visited them. If you maintain health, you needn't worry about these things because there's nothing that you can catch, and there's nothing that'll catch you. Is the time about up? When do you wish to leave? It's up to me. It's about time for us to get started for that radio station, so I want to tell you one little story before I quit. A number of years ago, I invented or concocted or devised a serum, a very marvelous serum, to immunize you against burning. I took the watery exudate or effusion in a blister that had been caused by burning, and I put it through a process that lasted for a few days, and then I took a volunteer subject and inoculated him with the serum. I gave him 3 inoculations, 1 a week for 3 weeks. Then I picked him up one day and I set him down on top of a red-hot stove. Contrary to the old adage that he who sitteth upon a red-hot stove shall arise quickly, he sat and laughed at me. I called it blisterine, the serum, blisterine. It was something that would immunize you against the virus that causes burning. I was not able to get the serum manufactured and marketed, so I didn't make millions out of it. But I did demonstrate that it is possible to immunize an individual against cause so that he can take the cause into his body or onto his body and it will have no effect. Being successful in that, I inoculated a man with raw alcohol for 3 weeks, once a week for 3 weeks, and immunized him against drunkenness. And then I let him drink all he wanted to, and he remained sober. I inoculated another man with white lead once a week for 3 weeks to immunize him against painter's colic. And I was eminently successful. At least I was successful as all other immunizing programs. I had found that I was able to set aside the law of cause and effect and let people violate the laws of life with complete impunity. Thank you.